You're probably listening to this today because you've been recommended a procedure called bone grafting.
That's right.
And if your dentist is talking about this, it really means we need to talk about foundations.
Mm-hmm.
You know, when a tooth has been missing for a while, or maybe gum disease has caused some damage, the jawbone underneath it can start to wear away. So our goal here is simple, just to give you a clear overview so you feel prepared for your next consultation.
Before we get started, I do have to share a crucial note. This audio overview was generated using AI for educational purposes by Carey Family Dental and does not replace a consultation with your dentist.
Right. An important point. So let's break down this idea of bone grafting.
Okay.
It's basically the process of rebuilding or, strengthening that jawbone foundation when there isn't quite enough solid structure to work with.
That's a perfect way to put it. I mean, if you look at the word graft, it's really just any tissue that's transplanted to become part of your body.
I see.
And in dentistry, this surgery is all about making sure there's solid ground to support future dental work. We're usually talking about implants.
So the reason for it isn't just cosmetic, it's really structural.
Oh, absolutely.
Bone loss can happen after an extraction, like you said, or gum disease, or just from the jaw not being stimulated by a tooth root anymore. Without that solid base, any restorations you put in later might not be stable enough to last.
And, the biology behind it is really the amazing part. We place this donor material into the area that's missing bone.
Okay.
And this material, it acts like a temporary scaffold.
A scaffold, right? So it's a guide.
Exactly. It's a guide that encourages your own body to heal itself. Over time, your body integrates that material and just naturally produces strong, healthy, living bone right where you need it. The graft isn't a permanent patch, it's more like a launch pad for your body's own repair system.
That process brings up probably the most common question we hear. Where does this material actually come from?
A very fair question.
It seems like there are four main types. First, you could receive your own bone. I think it's called an autograft.
That's right, an autograft. We take a small piece of bone from a donor site somewhere else on your body.
Okay, or it comes from an external source.
Yes, and those are always, always rigorously sterilized and safe. We're talking about sterilized, freeze-dried bone from another person or bone from an animal source, often a cow.
And then there's a fourth option.
Yes, synthetic or manufactured materials are also a great option in many cases.
So with all these different materials, how is the choice made? And how often does the graft, get rejected?
The choice of material is completely personalized. Your dentist figures out what will be most effective for your specific situation. And while there are risks with any surgery, some minor pain or a localized infection, a serious rejection is a managed risk.
And if it is recommended, the dentist is confident it will work.
Exactly. They see a predictable outcome.
The only real alternative, I suppose, is to do nothing. But that could mean that implants just aren't on the table for you.
Correct. It might limit you to other treatments that can be less stable or maybe not as comfortable in the long run.
And what about recovery? What should someone expect?
Well, it's important to remember this is a very common and predictable procedure. So some temporary soreness or swelling is totally normal.
But it's manageable.
Very manageable. And your dentist will go over exactly how to handle any discomfort.
Okay, and in terms of aftercare, it sounds like the single most important thing is just leaving the area alone.
That is the number one rule. You have to be so careful not to chew near it or disturb the site in any way.
Let it heal.
Let it heal. If you leave it unharmed, you'll get the fastest result with the fewest complications. And once it's fully healed, you can treat it like any other part of your mouth.
When we look at the big picture then, bone grafting is really all about long-term success, isn't it?
It is. It's about ensuring the stability of any future dental work, which helps maintain your overall oral health and even your facial structure.
So the takeaway for you, the listener, is this. If bone grafting has been recommended, it's because your dentist is planning for the healthiest, most predictable outcome possible. They're personalizing the whole approach just for you.
And as you think this over, just consider that amazing natural ability of your body to take a transplanted tissue, a temporary scaffold, and turn it into a permanent living foundation.
And finally, just to repeat that important disclaimer as we wrap up our deep dive, this audio overview was generated using AI for educational purposes by Carey Family Dental and does not replace a consultation with your dentist.